Hello and welcome to all our viewers in Nigeria and around the world to Health Guide on Global Television, your hub for topical discussions on health matters. We delve into a pressing global health concern, the outbreak of cholera. This highly infectious disease caused by contaminated water and poor sanitation continues to impact millions around the world, especially in vulnerable communities. And here in Nigeria, we experience an outbreak with Lagos, the epicenter. We'll explore the origins and spread of cholera, its devastating effects on public health, and the strategies being employed to combat this deadly disease. My guest on the program is a medical doctor, a public health practitioner, and plays advisory role with Refugee Commission. And she's also a public policy analyst who is passionate about public health, child and maternal health, and disease prevention. My guest on the program is Dr. Fatima Abdullahi. Many thanks for joining me on the program, Ma.
Thank you for having me.
It's a pleasure to have you join us.
Thank you.
Okay, just like I established, cholera is in the rise, particularly now in Nigeria. There's outbreak of cholera, but what I understand by cholera is that it's a deadly disease, and that has to do with poor sanitation, just the very basics. But do you want to establish what cholera actually is, so that we have an in-depth understanding of what it is?
Yes, so cholera is actually an acute diarrheal infection that affects people from the children all the way to adults. It does not discriminate, and it's infectious in the sense that it's easily transmissible from one person to the other, mostly from drinking, water, contaminated water, or eating food that is contaminated with the bacteria that causes the disease.
Oh, that's good to know. But how do we begin to? What are the causes? So you just mentioned that as well. But are there other causes, and then the prevention? How do we prevent? Do I need to panic, or just little measures I need to put in place, like wash my hands, to be able to prevent it? And are there vaccines to be taken for cholera, or what measures can we put in place to know? And how do we identify quickly and maybe nip it in the bud, and then preventive measures that we can take to address cholera?
Okay, so first and foremost, do not panic.
Okay, very important.
Yes,
Thank you.
do not panic. It's a preventable disease. As long as we take into consideration, sanitation. The most important thing for cholera is to have, portable drinking water, safe portable drinking water. And once people have access to that, and then ensure, appropriate disposal of waste and feces, and, the general hygiene measures you do: wash your hands before you eat, wash your hands before you cook, wash your hands after you go to the toilet, and ensure that you eat properly cooked food, and avoid, eating raw food or uncooked food, or, partially cooked food, especially seafood, fish and seafood. Yes, it's very important. So once you observe these measures and you keep a critical eye, it's not something to panic about. Yes.
I see why it's important to hear from a medical practitioner, because it was my teacher, interestingly, that says, you don't have to cook your fish till it's done for you to get the nutrients. I don't know if you've heard of that notion before, but I'm hearing now that seafoods particularly need to be cooked properly before you take them. But I used to think, in fact, there was a time I told my mom, she was trying to make seafood, and I told her, no, you don't have to make it done. It's even finer, and you get the nutrients when it's half done, like fish and seafoods in general. But I'm hearing from you now that you need to cook your food properly, especially seafoods, to prevent cholera.
Yes.
I'm sure you must have heard this notion flying, or is...
Yes. So I mean, if you look at it in terms of us trying to make sense of it, contaminated water that is contaminated by feces, that has the bacteria that causes cholera, automatically would get into and on the fish and seafood. So if you're cooking and you don't cook it properly, what it means is you're ingesting, including the bacteria that has not been killed through that cooking process. And that's what increases your risk.
Oh, thank you. But now we know that there's a spread of cholera. Cholera has been a disease that has been here for quite some time now. It comes and goes, there's an outbreak, and people panic, and now it's here again. In other states as well, but Lagos is the epicenter. And, you're a public health practitioner. I'm sure you must be in the know. You want to tell us what are the measures that is being taken now to ensure that the widespread is mitigated?
So I think from the report that I saw from NCDC, it looks like the outbreak is being contained. So there's a technical working group that consists of the NCDC, the Federal Ministry of Health, Ministry of Environment, Water Resources, and the National Primary Healthcare Development Agency. So they have a technical working group that is looking at, the emergency preparedness for each state and ensuring that states are reporting cases, the cases and the deaths from suspected cholera disease. And so by doing that, they are able to quickly, activate emergency responses where necessary. And also the information and enlightenment that is going out to Nigerians about what they need to watch out for and what they need to do is very critical. Vaccines are available now, but vaccine is not a strategy that can be used. It's not like COVID, you understand? So it's not a strategy that you want to vaccinate everybody across the country just to prevent cholera. So you might go to very high risk areas and provide vaccines, but it's not the first step in cholera prevention of the spread of cholera in the country. So, but there's a lot of awareness creation, and the technical working group is really on hand, working to ensure that the spread is contained.
Okay. Like you mentioned, that the technical groups are working on hand to ensure that the spread is contained. But if you were to rate it, do you think they should do more? Are they doing enough to ensure that the spread is curtailed? And as regards the issue of vaccine, is there a vaccine particularly for cholera? There's a vaccine for cholera.
Yes.
But it's not available here what's the availability?
In Nigeria. It's available in Nigeria. I think there are 3 WHO pre-qualified vaccines, and they are available. They're not part of for example, the regular vaccines that we give children,
okay.
But they are available.
Which obviously means that if I take a vaccine for cholera, I'm not prone to... So I want to understand why they are not readily available, especially in rural areas where there could be an outbreak that would not be easy to control. Is it cost effective, or why are they not available to rural communities?
So if very high risk communities are identified where the spread is is spreading very quickly, or in emergency situations, for example, there's a displacement somewhere and you have IDPs at this time where there's already an outbreak, the natural response would be to go and provide vaccines there. Because it's a small community, you are able to provide vaccines for almost everybody and you're able to contain it. But it's not feasible for the country to do a widespread vaccine campaign for cholera and give every Nigerian, well, over 200 Nigerians, 200 million Nigerians, so it's not feasible. But, because it's a preventable disease, just hand washing, and being careful with, the water you drink and the food that you eat, is enough to prevent the spread.
Okay. Thank you, Dr. Fatima. But let's talk about the economic effect and impact of cholera in Nigeria, because now a lot of people are not patronizing foods made outside, which of course is reasonable because you're trying to prevent yourself from getting cholera, especially restaurants where you're not familiar with and you don't know their hygiene policies. But I know that it's going to affect a couple of businesses, those who do. So, but what are the businesses, and how does this outbreak affect the economy?
So when you're looking at the economic implication of this, you would want to look at it on 3 different levels. you'd first want to look at it at the household level, because there are economic implications even for the house where someone is infected with cholera or a couple of people are infected with cholera. Most Nigerians are accessing healthcare from out-of-pocket payments. They pay to access healthcare. A lot of Nigerians are not under insurance, any insurance scheme. So if a household that would be using 2,000 naira to eat a day end up having to deal with cholera and the effects of the infection in their own household, they would use that 2,000 naira instead of feeding to then buy medications and do all the treatments, right? And the recuperation process. So it affects the household first and foremost economically. And then it also affects the community. So when you talk about the businesses that are not, thriving because everybody is afraid, that is one aspect of it. You would also have people that would normally go to work that cannot go to work. So you have, workers having downtime, which translates to loss of some kind of economy for the community. And then you look at it from the level of government as well. All of these things that government is deploying, the vaccines that they have to deploy in some certain areas, the technical working group meetings that they have to continue to have, the the emergency preparedness, all of the resources that they have to put in. Those resources probably would have been used for something else. But now because of this outbreak, they would have to then repurpose it and use it for the cholera outbreak. So it means the other thing is losing, the funding because of this. So there's a lot, in terms of economy and how this affects it.
Okay. Okay, let's talk about sensitization now. How do we get, enough sensitization to rural communities? Now, we read in the papers that schools are scared, especially now that the summer break is over and students and pupils will have to resume in school. And there's, fear, panic. Parents are scared to send their children back to school because children are prone to contacting these diseases because of, how vulnerable they are. I want you to talk to me because you're also very passionate about child health. What schools can adopt, what measures schools can adopt to ensure that they curb. We can talk about sensitization for the older students and rural areas, but when it comes to children, adults will have to be extra careful. So what effective measures can schools adopt to be able to curb this spread among children and even in rural areas as well, sensitization in the rural areas?
Okay, so the thing is, I think what has happened to us is post-COVID, everybody, the moment they see there's an outbreak, everybody is edgy, but the mode of transmission for cholera is not the same with COVID, where you're having to have 2 meters or whatever between you and the next person, and coughing is a problem, breathing is a problem, everything is a problem because it's in the air. For cholera, it's mostly around what you ingest. You understand? So it's what goes into your mouth, either in terms of liquid or in terms of solid, but it's what goes into your mouth or your fingers. So for children, I think it's pretty easy. First, for parents, from the home, what you're putting in your child's food bag to go to school. Make sure the water is clean, right? And the food is properly cooked. If you've got fruits in there, wash very well, and then you send your child off to school. Now, the school's responsibility is to ensure that there are hand washing points at every point in time, every location in the school. So if the child is coming from the gate, every child washes their hands before they go in, right? In the classroom, when they go to the toilets, they should wash their hands when they're coming out. There should be a station there, a hand washing station there, and somebody there to ensure that every child that is coming out is washing their hands. So when you ensure these happen, and every child eats what they bring, so there's no exchange of food between the children. So eat what you bring from home. So that way, if there's just the one child, it's really not, it's a contained situation. It's not going to spread because this ate this person's food and this person. So it's basically observing that. And then if the school also has source of water for the children, then the school also has a responsibility to ensure that the water is safe that the children will be drinking.
After post-COVID, a lot of people, we used to, before during COVID, we used to have hand washing basins everywhere, even in front of banks and all that. I think it should be a practice that, we should imbibe. But these days, you don't see them anymore until there's another outbreak again, and then we should. So I think continuity and consistency, if I'm right, should be what we would follow. But now we'll take a quick break, and when we return, the conversations with Dr. Fatima Abdullahi continues. Do stay with us.
In an ever-busy world, the increasing challenge of keeping track of health matters can be extremely demanding. Follow the latest health tips and trends on Health Guide on Global Television on Tuesday at 3 p.m. Health Guide on Global Television. Put your health first. In an ever-busy world, the increasing challenge of keeping track of health matters can be extremely demanding. Follow the latest health tips and trends on Health Guide on Global Television on Tuesday at 3 p.m. Health Guide on Global Television. Put your health first.
Gets in contact.
All right. Thank you very much for staying with us. If you've just joined us, this is Health Guide, the program that brings you topical issues on health matters. And I've been speaking with Dr. Abdullahi Fatima, who is a public health practitioner. Before the break, we were talking about prevention in schools and how we can, prevent that. And I just want to ask how fast cholera can be contaminated, the time of maybe inception or ingestion, and how you can contaminate, how you can get contaminated. I want you to establish that fact, the period or duration of time.
Okay, first and foremost, just to tell you that of everybody that gets infected by the cholera virus, only about 20% would exhibit some kind of symptoms, would have diarrhea or would vomit, only about 20%. Now, between the time that you get in contact with the bacteria and when you start to exhibit symptoms, it could be a few hours, to about 5 days. So it's not it's acute, it's a short time, but it could be from a few hours to about 5 days. So this is important for people to know. So if you meet someone and the person is not showing symptoms, it does not mean that the person doesn't have cholera or that the person cannot infect your water if they're touching your water or they're cooking your food. So it's for us to be more careful and to, like you said, consistency, to be consistent with our, sanitation, our hygiene practices, washing our hands, washing, your fruits, washing your vegetables, raw vegetables properly, salt and vinegar and the rest of them, and then, cooking for the food that you need to cook, you cook very well.
You know what, Dr. Fatima, we cannot stop because whether we like it or not, people will still patronize fast food restaurants. Is there a way that we can oversee to it that industry is regulated? I mean, we have a whole lot of maybe registered, a whole lot of restaurants. They open on a daily basis, and people patronize them, at their own risk. So shouldn't we have maybe like a body that sees to it that these, and then those that are not registered, how can we stop them? Sometimes we get emotional, we don't want to put people out of business, but this is at the detriment of the health of the entire public.
So I think there's a body that is saddled with the responsibility of ensuring that every eatery is safe. And if I remember clearly, even the cooks and the staff there have regular medical checks just to make sure that they don't have any disease that can contaminate food that people would eat. I cannot say if these agencies or these regulatory bodies are working effectively. That I cannot say. Yes, but I think we have those existing. You see,
Existing.
Nigeria is a country where we have very fantastic policies on paper. We have fantastic agencies, with the right mandates, but implementation is where
the issue is.
Yes.
So, but cholera has been an annual occurrence. Like I earlier mentioned, it has been happening over and over again. Is there a possibility that we can put an end to cholera?
No, there's no possibility that we can put an end to it. It's just that we can reduce its damage to the bare minimum. Yeah, so as long as states are alert, as long as our healthcare workers are alert in the hospitals, because when the cases come to the hospital, it's the healthcare worker that needs to then, press the alarm button, and it gets cascaded all the way to state disease control agency and then to CDC.
And then cholera, we know that cholera is prevalent in Africa. It's prevalent globally, but in Africa, the cases are more predominant. But recently, the UN has declared a state of emergency on cholera. I saw that this afternoon. So it just shows that it's a global phenomenon. And I was just going to ask how international bodies can partner with us to help, address this issue of cholera outbreak. But now that we see that a state of emergency on cholera has been declared, is there a way international bodies can, partner with us? And what does that mean? What's the inclination that, there's a state of emergency for cholera?
So, I think what it means when they say there's a state of emergency is, those countries and those agencies that are sleeping should wake up, and it also alerts those that do not have the issue yet, to be more conscious, because it's going to come. Currently, I know there are international bodies that are actually working with the Nigerian government at all levels. WHO is there. There are so many of those organizations that are working with the Nigerian government at the moment. They don't come out to show that they're working, but they are working behind the scenes to try and help the government. I think, unfortunately, I think the level of access to potable water in our rural areas is still very poor. And that's why, they're vulnerable, and also waste disposal is also very poor. You have open defecation in waterways, and the rest of them still happening in 2024. So it's only expected that these sorts of diseases will pop up from time to time. And until we sort out and we resolve the issues at the root of it, before we can prevent it to a very large extent.
I like that you say that until we solve it to the root of it. But what are we doing about, I don't like it when we have to, consistently talk about what the healthcare sector is doing or what the government is doing to curb things at the surface level, at the root causes rather than the surface level, because what we see is surface level prevention and attack. But how do we begin to, curb this at the root? What are the steps that we should take to, begin to address it at the root so that the cases will not be that much and, we can be able to some level, fight cholera?
So this is where we see the intersection between health and other sectors. This is not entirely the responsibility of the Ministry of Health. It's a health issue, but you would find a place for Ministry of Water Resources. You'd find a place for Ministry of Environment. You'd find a place for a lot of other sister agencies that also should be on board with the Ministry of Health. And it's this, because we're discussing cholera now, is why we're having this conversation. But it's beyond cholera. There are several other things, that are there that we need to approach it holistically. And if we do approach it holistically, the good, that comes from it, that's going to come from it, the benefits, the advantages, limitless. Yeah, but we're in a country where we would say we are resource constrained. And so we need to prioritize. There's a lot of prioritization. Where do we put money in? Are we going to put money in education? Are we going to put money in infrastructure? Are we going to put money in health? And the rest of them. There are so many competing areas that need these meager resources that we say we have. Yes.
Thank you so much, Dr. Fatima, for your time with us. You know, you've been extremely, your contributions are valuable. Thank you. And on that note, this is where we draw the curtains on Health Guide. And if you've just joined us, we're wrapping up and we'll be speaking with Dr. Fatima Abdullahi, who is a health practitioner. Join us same time next week for another insightful and educative episode of Health Guide, where we bring to you topical issues and how to prevent health-related illnesses. But for now, have a beautiful day ahead. Thank you.